My name is Naomi Akidenor, and I was born and raised in Lagos, Nigeria, and my family moved to the United States when I was 13.
I'm Anna Yang. I'm from New York City. I am currently set to go to Thailand in Bangkok to essentially do a mixed method study on mental health for elderly patients living with HIV.
My name is Sam Edwards. I was born in Ghana in Western Africa, but I grew up in Toledo, Ohio. Seeing how the pandemic was handled and then, comparing life abroad to life in the US and having an international family and always thinking about like, wow, healthcare delivery is not uniform everywhere. Why does that exist? But if we have an equitable view of just humanity and we care about everybody, got to do something to make things a bit more fair.
My name is John Lasher. Originally, I'm from New York. I am going to Sierra Leone. I'm going back to West Africa. I was working in Sierra Leone for 8 years before starting medical school. Started working in Sierra Leone during the Ebola outbreak, but very quickly realized that there are many health issues that Sierra Leoneans are confronting every single day. And one of those issues is something called multi-drug resistant tuberculosis. These are people who have had tuberculosis, had treatment for tuberculosis, but their tuberculosis is resistant to the available treatments. Treatment for this tuberculosis exists in the world, but it didn't exist in Sierra Leone until 2017. My project will be understanding why some patients who now have access to appropriate treatment for multi-drug resistant tuberculosis, why some of those patients are succeeding in treatment and why some are failing.
My name is Fatimata Barry. I'm originally from Guinea, West Africa. However, in the States, I am from Harlem. I've always known I was going to come into medical school. I think early on, I had a strong passion for women's health and advocacy, and I felt like women had a right to have power over their body and have autonomy. And I think that early experience really drove me to come into medical school. So a lot of my why has been my own, me trying to navigate my own body, and then in turn realizing that if a woman understands her body and has choice, then she can make decisions that are going to be not only impactful for her, but for her and her family. It's like you can empower her through her body. So that's my reason for medicine.
My name is Yagana. My family's originally from Afghanistan, and I grew up in the Bay Area, having come from a war-torn country, and seeing just the amount of, unfortunate circumstance around the world related to conflict. It's also a very hard space to work in and a scary space to work in, and it's an opportunity to show up and do what's right when it's not easy. And so I'm hoping to make an impact in that area.
My name is Ezzy. I am a third-year medical student in the Global Health Pathway. And for Discovery Year, I'm going to Nigeria to conduct a study on the barriers that women diagnosed with endometrial cancer face in assessing or like getting to early diagnosis and treatment. My motivation for going into medicine was kind of born in Nigeria where I grew up, and getting to see like the community kind of come together and provide care where they've been failed by the system, failed by the government. I saw a community come together to provide care for each other, and I kind of built that sense of community and a sense of like wanting to give back to that community. And so that's something that was very important to me. As I go through this process, med school, becoming a physician, is to give back to the community that, kind of inspired me wanting to become a doctor.
Being a practitioner in this space, particularly an American, and a white American with a lot of privilege, who gets to work in these international environments, I kind of grapple with my own positionality in that. But while grappling with that and grappling with ethics, always coming back to wanting to serve those that need it the most and listening to those first and foremost in everything that I do.
I'm from Los Angeles, more specifically from Glendale, California, which is actually one of the biggest populations of Armenians outside of the country itself. And my community and my background and culture is kind of what led me to medicine in the first place. Growing up Armenians historically have been displaced for centuries and centuries, and I started to see those parallels with patients at our local hospital that kind of felt that same displacement and foreignness and, you know, feeling out of place and not understanding that a lot of us grew up feeling as well. And I kind of started taking on this role of being not just a translator for the language my grandparents spoke, but also translating the medical knowledge, scientific knowledge between everyone around me. And I kind of started taking on more and more and adding on to that role, and it kind of just led me towards this path in medicine.
Having this new medical education and going back to Sierra Leone is going to make me approach problems in a different way. And I think it's going to show me problems that I had considered one way and make me think about them in a completely new way. And I think I'm going to be challenged to really think about how to come up with solutions to some of these problems in ways I hadn't had the skill set to do before. I think diseases don't respect borders, and I don't think we should think so narrowly about health as physicians, as future physicians. What happens in a place like Sierra Leone or Nigeria or Afghanistan matters whether you live in Los Angeles or whether you live in New York or anywhere else in America. I think understanding the root causes of poverty, understanding the structural forces that make it so that someone in Sierra Leone will get sick and die of something like Ebola, but someone in America will not, or understanding why in a place like Los Angeles, some communities will have a life expectancy that's almost a decade longer than other communities in the same city. These are things that we should all be concerned about, we should all be working towards. If we can prevent needless suffering and needless deaths by our work in global health, I think that's something we all ought to be thinking about. How can we make sure that everyone in our community, whether that community is Los Angeles, whether that community is America, whether that community is the globe, making sure we're advocating that everyone has equal access to modern medicine and the tools that exist now to prevent needless suffering.
What first drew me to global health, I think I was always around it in some ways because I was living in a country that was trying to develop its preventative healthcare system. And I think what made it appealing was like journalism a lot, from seeing like what organizations like the WHO did, what UNICEF did, and really being able to understand or perceive that whether I was in Nigeria, I was having a shared experience with like people in other countries that these organizations were helping serve. So I feel like what drew me to global health was that recognition that we had shared experiences, and I feel like that was a really uniting kind of feeling. I'll be going to Abuja, Nigeria, and my project is looking at how the out-of-pocket costs associated with surgeries drives people into financial hardship, and we call that catastrophic healthcare expenditure. I think the bigger picture for our work is just advocating for people and trying to use all of this as a tool for cultural advocacy. So I think I'm hoping that I can contribute to helping, mixed narrative, mixed global health, helping to use that to amplify the voices and experiences that people are having. And I'm hoping that ultimately that helps improve the national health insurance coverage in Nigeria.
We're working on a quality improvement project for personalized healthcare delivery for patients who are HIV positive and on antiretroviral therapy who've had treatment interruptions. So you have some people who need long-term therapy. For various reasons, they may have fallen through the cracks or haven't received their care in 5-6 months. Why does that happen? How do we, create a personalized care model? Are these options applicable to them? Are they getting the options that they sign up for? Those are the kind of questions that we're going to be investigating. Working on a project like quality improvement and like personalized care delivery for HIV positive patients, I think this has a lot of topical overlap to how you do complex chronic disease management for people in disadvantaged situations. Because cancer doesn't necessarily care where you're from or what your access to resources are?
I will be going to the University of Gambia. During my time at the Gambia, I will be partnering with the midwifery school as well as the nursing school and the Bachelor's of Science school. The goal is to pilot an AI-based OSCE module that will help assess baseline understanding of women's health as it relates to counseling and providing care, specifically as it relates to female genital mutilation. The goal of this project is to, one, learn the baseline knowledge of students there so we can hopefully go back in my fourth year, implement an actual AI OSCE within their curriculum to build sustainability. How will this work be sustained after my discovery year? That is something that is very important to me, and which is why I love this project that I'm doing, because I'm not just going to abstract data and say this is how people feel, but rather the goal is 2-3 years from now is to actually implement these OSCE modules within their curriculum. And right now it's focused on women's health, but the next thing could be focused on primary care. It can also be focused on surgical management of things, and eventually even interventional radiology, which is up and coming field. If you train people how to use the platform, they can build what they feel is necessary for their school. Last thing I would add is a lot of the decision, hindsight is 2020, and I think a lot of the reason why I'm here at UCLA has been heavily driven by, one, the discovery year and the global health pathway. My decision to come here and move across the country is because of that. So I'm just super grateful for this experience, because it's in the first time in my adult life where I'm able to use what I am learning in school in a way that I feel like it's going to impact someone and help me grow as a person. And I hope that this experience shapes me to become a physician in the U.S. that can see individuals from all different backgrounds and find a way to connect with them.
For my project, I will be going to Cape Town in South Africa. I was there last year for foundations, and I'll be returning, doing work there again with the Desmond Tutu Health Foundation and University of Cape Town. I'll actually be looking at the impact of the USAID funding cuts on HIV programming in there. USAID funding and PEPFAR funding accounted for a significant amount of financing to South Africa's HIV programming and health programming and overall, and South Africa has one of the highest burdens of HIV in the world. And we were talking about this earlier, but when the programs kind of abruptly shut down earlier this year, all I could think about, kind of going back to the person, was all the people that were going to be affected by it. I think it'll be a bit of a daunting task, but I was seeing as one of the roles is needing to listen to the stories of people that have gone through this and see actually what the impacts have been, from the highest levels of like academia and economists to those at the patient level who seeing how their care might have been disrupted, or how maybe their clinic has closed or their job isn't there in the way that it was anymore. And then from there, hopefully advocating to the government and, thinking about other ways to move forward. And I think using this as a moment, as devastating as it is, to, tread forth with hope and try to imagine a new world that is, again, serving people how they need it, and also serving in a way with financing that's more sustainable and isn't threatened by such abrupt policy changes.
I will be going to Armenia for my project, and we'll be doing a national assessment on breast cancer care and kind of the whole continuum, and trying to find what gaps exist. This kind of came about because compared to other countries in the region and kind of worldwide, Armenia has some of the highest mortality from breast cancer, and mainly because it's diagnosed at later stages. And I think it was the 4th highest mortality in the region. And on top of that, there's a lot of women who are diagnosed at really young ages, like a lot of people around our age as well. So we'll be doing this analysis across the national hospitals and then going out into the rural areas, trying to see what gaps we can help identify, and then try to create a policy reform or some recommendations, because it's a really exciting time right now in the country where they're transitioning into their universal healthcare model. And I think that not only for the future of Armenia, but also countries that are going through a similar transition, it might be really helpful.
I think global health really shows up the depths of humanity and our capacity to love one another. because global health is not just about us treating a condition, it's about us understanding someone's lived experience that is vastly different from ours. And it is super important for us to be social in medicine. Medicine won't, if we just knew the science, that's not enough, because it's one's lived experience that shapes their health. And I think global health is really getting out of your comfort zone and being able to say, why is this condition presenting this way within this community? What are the factors that have led for this endpoint? What is the story? And I think medicine is a story. It's a story of love. And I think as physicians, we are going into this passionate, driven, and it's because we are fueled by love, not just love for the field, but love for the next person sitting near us. And I think that's why global health matters.